Well, if you're consistently experiencing pain and cramps in your legs after walking that only goes away after rest, you may be experiencing peripheral vascular disease. And with us today is Dr. Juan Carlos Correa from Modern Vascular to explain more. Dr. Correa, thank you for being here this morning. What is peripheral vascular disease, or PVD? And if someone is diagnosed, what are their treatment options?
Absolutely. So to put it in layman's terms, just like the tubes in your house, as the house can get older, it can get clogged. And we experience the same thing in the arteries of our body. Now, there are things that can make that happen faster: having diabetes, smoking, having high blood pressure, and then a family history. And when the arteries get clogged, depending on the extent of how they're clogged and how much they could be clogged, that's when you start having symptoms.
What is it then that makes Modern Vascular different?
So we specialize and have a tremendous amount of passion in the first thing: saving people's legs. We do believe one leg at a time helps save not only that patient's leg, but it improves that patient's family and everything. We also take a lot of passion in the fact that we open up arteries that used to be considered no man's land. We open up arteries that are in the calf and even all the way down to the foot, if need be, down to your toes. Something that technology up until a couple years ago wouldn't allow it. We do that now every single day in our office. Majority of patients that don't get it treated, unfortunately, are at risk of losing their leg. But hopefully they never get to that point, but a lot of them, if they have issues, they just stop walking. That's that grandma or grandpa that, you know what, they don't want to walk, they don't want to get off their lazy chair. They maybe go and get the mail, and that gives them a lot of pain, so they just sit there.
And not to mention, like you said earlier, you know, you lose that family dynamic. You know, grandma and grandpa want to see their grandkids, and if they can't get out of that chair and do it, there goes that.
Exactly.
So talk a little bit about also treating venous insufficiency. Tell us a little bit more about that.
So the arteries come off the heart, they send blood flow everywhere.
Okay.
Now, once we get down to our feet, we don't have a pump in our foot that is actually going to shoot the blood back up. So we rely on, inside of the veins, a series of valves. As blood comes up, those valves closing and keeping it from just staying in our feet. And again, those valves, they get leaky. So imagine blood, instead of coming back up, sits in our legs. And that can cause symptoms from the heaviness that you get towards the end of the day, swelling. And then eventually, in, again, severe cases, there's so much blood buildup in your leg that it can start leaking through the skin and you end up with a wound. So that's also something that we can easily identify and treat.
Okay. Well, how can people learn more about that venous insufficiency, PVD, and Modern Vascular?
Well, if you go to our website, modernvascular.com, we have a lot of educational things right there that will send you to the links explaining peripheral vascular disease, why it's important to get diagnosed, because we do have surgical ways of treating it, and we also have a lot of passion in that, making sure that you're on the right medications, and we review everything about you when you come and see us. And then the same thing with venous disease. You can come in, and it doesn't mean you're going to get an operation or an intervention. You come in, we get screened, we figure out what's the best way to treat you as an individual to prevent those devastating complications. All
right, well, doctor, we appreciate you being here today and all the very valuable information that's very important for families. And if you want to learn more about PVD and to schedule an appointment, make sure you go to modernvascular.com.